coronavirus. Grace Kuria, KTN News.
Still on that, newly appointed Health Cabinet Secretary Mutahi Kagwe has officially taken charge of the ministry amid a crisis caused by fears of a possible outbreak of coronavirus in the country.
Kagwe will be taking over the ministry at the same time chairing a response team established by President Uhuru Kenyatta today.
And as Mark Namaswa reports, the new CS will not have it easy at the ministry as the government continues to have it rough, from Kenyans unhappy over the government's inability to respond fast.
As Mutahi Kagwe takes over the reins at the health ministry from Cecily Kariuki, he knows too well that the timing might not be what he would ideally wish for. Kagwe, a former Nyeri senator, arrives at a time the global landscape is in the grips of the coronavirus pandemic. Kenya too is grappling with preparedness issues. Hardly a week passes without a scare of the possibility of recording its first case. So far, no case has turned out positive, but the fear keeps growing.
We had a team 2 years ago that went to Liberia, and who are trained by WHO on the management of infectious diseases such as the one we are facing. Very few countries can boast of the kind of capacity that we have to manage them.
What he takes over is a build-up of interventions that have been happening in the last close to 2 months. You adjust your interventions, you scale them up depending on how the epidemic is evolving.
Kenyans continue to be a worried lot, especially with the arrival on Wednesday of a plane from China with 239 passengers. This at a time when there are over 100 Kenyans at Wuhan City, the epicenter of the coronavirus outbreak.
The government continues to expose our people to the highest possible risks of contracting the coronavirus by keeping our airspace open for all without any precaution.
The National Nurses Association called for a press conference to express concerns over the safety of their members in the wake of the coronavirus epidemic. But they say, pay attention to what has been said, but pay closer attention to what has not been said. This is what we found out. Nurses, for example, say they are ill-equipped to tackle the epidemic if matters get worse.
They're deeply worried because the first contact of this patient is going to be them. And I've also said it in my statement.
The association is at a loss over what is called self-quarantine for visitors coming to Kenya.
A scientific quarantine is measurable scientifically. And most important, a scientific quarantine must be supervised. I end there.
Away from the coronavirus fear, the issue of universal health coverage will be part of an in-tray for Mutahi Kagwe as he settles at the Health Ministry headquarters. Mark Namaswa, KTN News.
Universal health coverage will be part of an in-tray for Mutahi Kagwe as he settles at the Health Ministry headquarters.